So this year we commemorate the 271st birth anniversary of Hanuman. Okay? So hail homeopathy. क्या कर रहे हैं हम लोग? Modern brand. Okay, so one of the finest articles by Hanuman. Okay, one of the finest articles. If I ask you which article or work of Hanuman would you like or rate as the most important one or the one which influenced the most in your life, what would that be for any of you? Like if I ask you, medicine of experience. Ma'am, आपके लिए medicine of experience. Which one? Medicine of experience. Okay. What about you? What do you think? The chronic diseases. Okay. Sir, what about you? Materia Medica Pura. Aditi, what do you think? Friends of health. Okay. The chronic diseases. Soma. Effects of coffee. Okay. Saloni, which work of Hanuman has influenced you the most? The chronic diseases. Okay. What about you? Chronic. Rahul, what do you think? Chronic diseases. Now, if you ask me which work has influenced me the most, it's the Organon. The Organon of the art of healing. Because that's where you have all the principles defined about the practice of medicine. The practice of medicine which aims to heal the person who's unwell. And because we all refer to the later editions of Organon, so it contains everything which is essential as a principle, even relating to the chronic diseases. Everything related to the principles of chronic diseases as well. Okay? So we all have personal choices. Like he says, the medicine of experience, for instance, it's one of the precursor articles to the Organon. Okay? Now, the work on chronic diseases. So, interesting part. Hanuman never gave a theory on chronic diseases. Okay? So, when he published his work on the chronic diseases, he never wanted to publish the work. His idea was to create a hospital, if that could be created, where he could demonstrate how to treat the chronic diseases. Okay? So his work on the chronic diseases was always the chronic diseases, their peculiar nature, and their homeopathic cure. That's the title of a work. Nowhere has he used the word theory at all. Okay? The problem is today when people talk only about the theory of Hanuman. Okay? The other thing in the title, has he ever mentioned the word called miasms? The chronic diseases, their peculiar nature, and their homeopathic cure. He hasn't used the word miasm anywhere. Okay, second part. Next, when he talks in Organon, aphorism 153. When he says in aphorism 153, he says that what are characteristic symptoms in homeopathy? Striking, which will strike your senses, which you can't miss, like in Cuprum Met. Can you tell me any striking symptom which is observable by your senses and which you can't miss? Any one striking symptom that is observable. Okay. Okay. So cramp is always a subjective sensation. Okay. But what would the objective symptom? So you're mixing up two symptoms. So you have, for instance, yes. So when you swallow, the drinks roll down audibly with a gurgling sound. What is that exactly? So it's like when you pour water from a bottle, so it makes a certain sound. That's called a gurgling sound. So when you find somebody drinking water and it goes down that way, that is drinks roll down audibly with a gurgling sound. Okay, so that's what you find in cupromet. Yes, laurocerasus and hydrocyanic acid, but nobody has it as marked as cupromet. Okay, also it's why we say cupromet more, because it's also one drug which has had exhaustive drug proving. Laurocerasus and hydrocyanic acid haven't had that kind of drug proving or intense drug proving. A lot of their use is more from toxicological data. Okay, then so that's one objective symptom, or what we call a striking symptom. Okay, any other striking symptom of cupromet that you think of, which is striking, that you can't miss, your senses will not miss? Okay, but that's again a modality that the patient will say, okay, I feel better with cold water. But something which is objective, come on. So what Aditi said, a triple paroxysm cough. Okay, that's an striking symptom that you cannot miss. What other objective symptom can you think of? Come on, come on. Okay, so hiccup can be a part of many remedies. It's again a symptom. So unless we have that qualified with something, what else can be a striking symptom? So for instance, tongue. The tongue of cupromet is extremely striking. So they say tongue like a snake. It goes in and out very fast. Okay, difficult to protrude, and even when it does, it forks in and out very fast. That's a very classic symptom. So when it is difficult to protrude, it is like lachesis, but when it moves in and out very fast, it is a striking symptom. Okay, so what they call a serpent like tongue. So if you see a serpent like tongue is the one which will fork in and out very fast. Okay, so it's a striking symptom that you can't miss. Okay, what other symptom? Come on guys, it's a common remedy. I'm sure most of us have studied many times. So for instance, cramps begin in the, or spasms begin in the extremities, and they are flexor. Okay, then there's, I mean, some quite striking symptoms. So for instance, in cupromet you'll also find that anybody who has a seizure disorder or a convulsive phenomena, or especially in children, what they'll do is they'll lie on the belly in any spasmodic phenomena, whether it is vomitings, or it is a seizure disorder, or it is hiccough, or it is coughing. And when they lie down on the belly, what they'll do is they'll rhythmically jump, raise, and descend. The hips will ascend and descend very spasmodically. That's also a striking symptom you can't miss. So there'll be an up and down jerking movement of the pelvis when they are lying on the belly. It's a striking symptom, you can't miss that. Okay, next is a singular symptom. Okay, in aphorism 153. Okay, singular, which is found in very few remedies and in very few disease conditions. Okay, very few remedies, very few disease conditions. Gee. So we're talking about aphorism 153. Okay, striking, singular. Okay, tell me some singular symptom of Cupramet, some singular symptom found in very few remedies. Like, for instance, aura in seizure disorder or convulsion begins in the knees. Okay, so it's singular to Cupramet, found in very few remedies. Okay, are we together so far? Okay, so that's striking, singular. Then uncommon. Okay, which is uncommon to what you would normally expect. Okay, so for instance, in Cupramet we find one symptom. They say ailments from inadequate sleep. We know that, right? It's there in Cupramet, it's there in Cocculus, it's there in Nux vomica, it's there in a few other remedies. Okay, but is that a common thing or uncommon thing? So a lot of people do suffer from, when they don't sleep enough, then they do suffer with some symptom or the other. But how do you prescribe then Cupramet or Cocculus or Nux vomica when? So if they say यार 5 मिनट भी कम सोया ना मेरी तबीयत बहुत खराब हो जाती है, when you have that kind of a correlation, even 5 minutes of inadequacy will give rise to many symptoms. That's when you use this as a symptom. It's very obvious, if you've attended a wedding late at night and you slept, instead of usual 7 or 8 hours of sleep, if you sleep for 6 hours, you'll wake up with a little heavy head. You might feel you might not clear your bowels very well. But do we prescribe a remedy for that? No. What would you prescribe? It's what we call indisposition. Then you ask them, you give them placebo and you ask them to rest. But if they come up with overt symptoms or magnified symptoms, even when they have slept for something as trivial as 5 minutes less or 10 minutes less, and they'll have overt symptoms, that's when you think of remedies like Cupramet, Cocculus, Nux vomica. So that's not uncommon. Can you tell me any uncommon symptom of Cupramet? Any uncommon symptom?
Suffering by drinking cold water.
Yes, that's different. Okay, it's uncommon to the common pathophysiology, like causticum also has that. Okay, so causticum, Cupramet are important remedies. Cough better drinking by drinking cold water. Okay, so that's uncommon. The last part is peculiar. Okay, now remember this aphorism 150, the peculiar, is also what Hahnemann has used in his title of the work on chronic diseases. The chronic diseases, their peculiar nature. Peculiar means which is a tendency. Okay, so chronic diseases by nature are relapsing and remitting. So, for instance, at every change of season, somebody develops a cough. Every time they will eat out, they'll have a stomach upset. This is a peculiar symptom. And that's what Hahnemann strongly describes for all those who will understand. A man whose words are always pregnant with meaning. The chronic diseases, their peculiar nature and their homeopathic cure. The only way you can cure it is when you apply the fundamental of similia. If the drug is not homeopathic, it will never lead to a long-lasting cure. And I'm sure if you look back in your practice, I'm sure you all make efforts. I also make effort with all the patients that we see. But in some patients, you'll find that you've prescribed some remedy and the patient recovered remarkably beyond our understanding and imagination. That is where our drug and a potency was exactly homeopathic to the case. In other cases, where their patients are getting better slowly over time, so we know that the correct homeopathy has not been applied, or the homeopathicity of the prescription is missing, or in the potency is missing. Okay, so that's the case where you'll find that everything will unravel at a pace. It may happen over weeks, months, or years, but it'll be beyond our comprehension and understanding. And I'm sure we look back, we'll always find 2, 3, 4, 5, 10 cases where we've had remarkable results. Okay, not in acute conditions, where in chronic conditions, because in acute conditions a lot of symptoms are anyway self-limiting and they can be managed easily. But of course it doesn't mean that there are serious acute conditions where if you don't prescribe the right remedy, it will not recover that fast and there'll always be complications. You'll require more or more management or what. So so for all those who enjoy Hahnemann's work on chronic diseases, remember, when he, in the title, he never uses the word miasm anywhere, and he talks about their peculiar nature, which means if you don't treat it with homeopathy, it will never ever lead to a cure. And we have ample experiences around us in our own practice, or if we just look around in our extended families, friends, people will keep on taking medicines for blood pressure, diabetes, renal failure. The disease will keep on progressing, whether with homeopathy or with any other medication. But only if you prescribe the right remedy will you be able to give them what we call either an extensive palliation or a cure. Are we together? Now, any one symptom of Cuprum which is peculiar.
The sudden jerking mood swings.
Okay, so जो आपने मैम पहले बोला था, like a tendency for spasms and cramps. So all the tendencies are peculiar symptoms. A tendency for spasms and cramps. What else? What are the one symptom which is a peculiar symptom of Cuprum? Tell me one.
Spasmodic dysmenorrhea.
Any yeah, spasms and cramps. They're all peculiar symptoms of Cuprum. What else? Okay, okay. Sorry? Yes, ailments from suppressed eruptions. Okay, so all those which are tendencies that this will lead to complications, all those symptoms which will always relapse and remit. Okay, like for instance, all the convulsive phenomena is also something which will keep on coming back. Okay, they are all peculiar symptoms. Like for instance, uh, it's an excellent remedy for spasmodic phenomena, like for instance excellent remedy for nausea and vomiting which accompanies a lot of symptoms. Okay, an excellent remedy where vertigo occurs as a concomitant to many symptoms. These are all the tendencies or peculiarities which establish that it is one of the remedies for certain chronic affections when symptoms agree. Are we together? Okay, this is in a nutshell why Organon is my favorite text. It's the Bible in homeopathy, as they call it, and I believe it should be your favorite work of Hahnemann because it collects everything, whether it is from the bad effects of coffee or the medicine of experience or the chronic diseases, anywhere. It draws from everywhere. Okay? Plus, the next article which I believe you should read from Hahnemann is the Medical Observer. Never ever forget that, because that's where he writes, it is required to practice homeopathy the art of observation, which is not ordinarily found in physicians. And he says you have to develop that art with your sheer hard work and labor. That should not be missed. Are we together? Yeah. So the organon and the medical observer. If you want to prescribe your medicine, you will have to observe the patients very, very carefully so that you know whether you're prescribing the right remedy or not. Like, I'll give you an example. Okay. So if you see a patient who says, I love sweets. Okay. I love sweets 3 plus. Okay. I need 3 cups of sugar in my tea. I need to have that sweetened tea 3 or 4 times a day. If I don't get sugar after my meals or anything sweet after a meal, I'll maybe pick up my child's chocolate or I'll pick up some cookies. If nothing else, I'll just go and take a spoonful of honey, or I'll take 2 spoons of sugar like this in my palm and I'll munch it. So if they have got that kind of a strong craving for sugar, and they are very calm, relaxed, not anxious, apprehensive, would you give them argentum nitricum? Yes, no. You would not consider. There has to be a strong reason. So, observation is extremely critical for the practice of homeopathy. Okay? Like, for instance, if there's somebody who walks into your clinic with and crying with every symptom, at the same time they're sipping water from their own bottle, would you give them pulsatilla? Yes, no. No, you would not. There has to be a very strong reason to not look at that thirst. Okay, I'll be foolish to prescribe pulsatilla. Okay, so observation is critical, and you'll find many symptoms in Cuprum match which are striking. Okay, now when we are talking about Cuprum, how do we wipe this, please? So sorry, so sorry. Thank you. So, in Cupramet, one of the most important phenomena is, of course, spasms and cramps. Yes. So let's talk purely about convulsions of Cupramet. Okay. Now, I want you to look into any book that you want to open, any book. Okay. And let's divide the symptoms of convulsions into the triggering factors. Okay. Then we find the pre-ictal phase. Then we find the ictal phase. And then we find the post-ictal phase. And then let's look at the concomitants. So open any book that you want. Okay. But I want you to tell me one symptom. Okay. And let's try to compile this data, how you would be able to prescribe Cupramet really well in a case of convulsive phenomena. Okay. So we start with Rahul. Tell me one symptom in any of these categories, whatever you come across. Okay. So let me start with, for instance, the triggers like ailments from repercussed eruptions.
From getting wet.
Sorry?
From getting wet.
From getting wet. Okay. One person at a time. Okay. So we start with after Rahul. Young girl, what's your name, please? Deepa. Deepa, tell me one symptom. Getting wet, and somebody's mentioned fright. Okay, but please await your turn. You'll all have your turn. So it may not necessarily be in this order. Anyone that you know, any of the books you refer to. Okay, Saloni, what do you find?
Say the conversions usually start from the brain to the blueness of face and lips.
Sorry.
The conversions usually start from the brain to the blueness of face and lips.
So blueness of face and lips. Okay, so that's in the ictal phase or pre-ictal phase. Ictal phase. Yes. Of face and lips. Okay. सर आप बताएं एक कोई भी सिम्टम इनमें कैटेगरी में. Okay. When? Post-ictal. Okay. Prostration. Okay. Extreme. Okay. Suma.
So pre-ictal phase. Before outbreak, she feels a sudden metallic sour taste in mouth
Yes. Yes.
with flow of saliva.
Sudden metallic sour taste with increased salivation. Okay. Okay. Sir. कोई एक symptom.
Epilepsy arises from moon
Yes.
ascending to
So
happiness.
aura. So is that going to be pre-ictal or ictal? Come on. Pre-ictal. Yes. Aura. Aura is ascends from knees.
Ascends to happiness.
Okay. Okay. To hypogastria. Okay. Okay.
Followed by unconsciousness.
Okay. Yeah. No.
Post-ictal.
So that's going to be ictal phase. जब unconscious हो जाएगा convulsions के दौरान. Okay. So we have unconsciousness. Yes. Aditi. What else? Can you tell me?
Inability to talk and with all the spasms and throat will be
Okay. Sir.
Suppressed menses feeling factor.
Okay. Okay. So, like for instance, triggering also by blows and trauma. Yeah? Blows and trauma. Then you have suppressed menses. Okay. Okay.
Uremic conversions after cholera.
So, okay. After cholera. Okay. Fine. Okay. Ma'am.
So also when in conversions during sleep, near again only.
Yeah. During the sleep. So, where would you place it? Triggering factor, pre-ictal, ictal, post-ictal? Not really. It's going to be a concomitant phenomena. Okay, that convulsions which majorly come on during sleep, or you may also use it in triggering factor, that convulsions during sleep. Okay, yeah,
aggravation of pneumonia.
yes, yes. So triggering में आ जाएगा new moon. Yes, very good. Okay,
Coldness and collapse, cold sweats. And collapse.
yes. When does that happen? Before, during, or after? Yes, afterwards you have cold sweat. Excellent. Yeah, extreme prostration slash collapse. Yes. Okay, Varun.
Patient may become loquacious, impulsive, between the activities, but cold sweat can also be considered a case.
Okay. Yes.
Patient may have the cold sweat.
Yes. May happen. The cold sweat may be there during the ictal phase also.
Could be in both phases. Headache follows the event.
Headache. Yes. Headache. And what else did you say, Varun?
A patient may become impulsive, loquacious, dangerous.
Mental strain.
Yes. So that's also ailments from mental and physical strain.
And meningitis.
And then when piercing shoots and
So, for instance, in certain cases of meningitis, it has been prescribed, but we can't call it a triggering factor per se. It's more like a diagnostic condition, like uremic convulsions, for instance. Okay, bata do.
sir, conversions before menses, yeah, violent cramps extended to chest due to the suppression of menses.
Okay, yeah. So we've done suppression of menses. Yes. What else?
And amenorrhea due to suppression of foot.
Yes. So it is one of the remedies for ailments from suppression of foot sweat. And similarly, suppression of skin eruptions or suppression of discharges. An excellent remedy for that. Yes.
Post-ictal phase with this dullness of head and
Yeah.
the body feels as if eaten.
Yeah. Okay. Okay. Exhaustion, collapse. Yes. What more symptoms?
Converging with blue face and cleansed.
Yes. So it starts from the ictal phase. It starts from the extremities, especially fingers and toes, and then it ascends. Okay. And it's associated with especially flexor spasms. Come on, guys, I need more symptoms before. So, triggering factor, I think we've covered most of them. Yes,
Periodicity.
yes. So it's a remedy for when you have a lot of spasmodic phenomena and cramps. They usually occur periodically and in groups. It's part of the symptomatology of Cuprum.
Later by the
Yes, we've done that. The aura ascends from knees. Okay,
later by being mesmerized.
okay, okay. But tell me more symptoms.
Contraction of jaws with foam at mouth.
So, yes, so you have foaming, that's the ictal phase,
Alarm with
foaming at mouth.
jaws.
Yes, with trismus or locked jaw. Okay, yes, we may have opisthotonos. Yes,
Aggravation by
right?
touch.
sorry,
Chronic
clonic also and technic also. Both kind, yes. So when we have lockjaw, for instance, that's a technic spasm. For instance, clonus is when you have alternate contraction and all. That's where you also find, for instance, in ictal phase, they might be on the belly and jerking their hip upwards and downwards. Okay, so I'll be also part of that. Okay,
fright. Convergence from fright.
ailments from fright. Yes.
Complaints begin on left side.
Aggravation.
Okay. Okay.
Conversions aggravate by touch.
So yes,
From
they
tapeworm.
from worm infestations. Yes, parasitic infestations. Yes, and worse by touch during the. What else? What else? Come on, guys. Tell me more.
Lack of reaction.
Okay, so so okay, guys, lack of reaction. So, can you explain to me what is lack of reaction? For instance, why do we use that in Cupramet? Lack of reaction. Tell me.
patient is, the body should react to the medicine, but the patient is not responding, although the symptoms are completely going in favor of the remedy.
So a lot of times when we say in Cuprum at lack of reaction, it means, for instance, when the eruption suppresses and the seizure phenomena comes up. So the body is unable to throw it out. It goes within and creates more serious diseases. For instance, the foot sweat suppresses and the body is unable to throw that sweat or eruption or that discharge out and develops more serious symptoms. Okay, so that's how it is.
In colder, hot weather,
Yes, yes, ailments during hot weather. Yes, excellent.
Some ailment from mental physical overexertion.
Yes, we've done that.
vomiting associated with cold sweat,
Yeah, that'll be there. Okay, what else? What else?
can we face stammering or speech work?
Okay, yeah, okay, okay,
Paralysis sometimes.
okay. What else? What else, guys? Okay, open, all of you guys, open bogus synoptic key. Read bogus synoptic key. And now tell me,
Question what you just mentioned, the lack of vitality meaning the body is unable to, the eruptions are not able to reach.
so eruptions will automatically repercuss. The sweat will subside. So you have to understand your body's ability to throw out everything. Like, somebody's got food poisoning, for instance. And what will the body do? It'll throw it out, right? If think about it like camphor, a remedy which lacks reaction. So one vomit and the patient will collapse. They'll have no ability to throw it out. The body will just give up. Body will turn cold. There'll be no vomiting. They know they're having nausea, but they're unable to throw up. There'll be no evacuation. There's absolutely no ability to react. Okay, so it's likewise in all the remedies where there is ailments from suppression. So these are the remedies where you'll find that the body does not have the ability to throw it out. Okay, yes. So, पढ़ा आपने synoptic की? Now tell me more symptoms from there. Triggering factor, pre-ictal, ictal, post-ictal.
Anxiety, restlessness, tossing about.
बताओ राहुल.
Sir, spasm of calf emulated by stretching out leg.
Okay, okay. What else?
Backstroke cries,
Okay, yeah.
knotting the muscle.
Okay, yes. What else? Tell me. पढ़ो पढ़ो पढ़ो.
Spasmodic laughter.
Sorry?
Spasmodic laughter.
Spasmodic laughter when?
This is ictal.
Ictal phase? Yeah.
Suboxidation, affecting the centers of the
Okay, that's the first part. So basically, you have to understand what do you mean by oxidation related to suboxidation of the centers of my medulla. What do you mean by that?
Ischemia, fluid ischemia.
So you have to understand what is the function of medulla oblongata.
It's all about the positioning, the balance, and forward.
So what's the function of medulla oblongata? That is what he's telling you can be one of the effects of Cuprum Met. Okay. Now, for instance,
night aggravation, face,
yeah, okay. During sleep. Tell me more symptoms from bogus synoptic. What do you find? Pre-ictal, ictal, post-ictal. You'll tell me. Like for instance, ictal phase, there can be spasmodic laughter. For instance,
grinding of teeth,
yes, very good. Ictal phase, grinding of teeth.
closed mouth,
Yeah, that's trismus. We've done that. Lockjaw. What else?
Face livid pale or distorted.
Very good. That's we've did done the blueness. Yeah.
Metallic taste.
Yes. So we've done that. It may happen just in the preictal phase. Sudden metallic sour taste with increased salivation. Yes.
So they could be vomiting in the post-ictal phase.
Yes. They may throw up.
Yeah. And also they could be colic along the vomiting.
Yes. Vomiting with colic. So that's another spasm of the muscle. Yes.
So one thing is that hypersensitivity, every drug reacts without theory.
Yes. So that is a concomitant. It is also one of the remedies for people who prove every remedy that they get. People with idiosyncrasies who are extremely sensitive.
The remedies reaction will come to that basis.
So, for instance, if you give somebody, say, a dose of sulfur 30, they will start producing a lot of symptoms of sulfur. Okay. Now, this only applies when you believe in minimum dose. आपने किसी को बहुत लॉन्ग टर्म दे दिया तो थोड़ा बहुत सिम्टम रह ही जाएंगे. So it's also an excellent remedy. So for instance, you'll also find nodding to and fro of the head is one of the features of the, for instance, the ictal phase. So what are the concomitants now?
Cold sweat.
The concomitants, for instance, the tongue.
Without like a snake.
Yes, that is a, yes, that's a concomitant. Okay.
Metallic taste.
Yes, which can be there in the preictal phase also, and may occur a sweetish metallic taste may be there, which is as a concomitant. Okay, every symptom.
Also piercing shrieks.
Yes, piercing shrieks. So everything which is now related to, for instance, generally, so I'll tell you something very very interesting. In the post-ictal phase, generally, we know there's vomiting. Okay, that vomiting will happen only with solids. If they'll have cold water or cold fluids, they'll be retained. But if you give them solids, they'll throw them up because it is better by cold drinks.
बिस्मत का भी यही सिम्टम है.
So in bismuth, it's a little different altogether. In this, the context is that they will throw up the solid. But the spasmodic phenomena is better by drinking cold water. Spasmodic phenomena is better by drinking cold water. Okay. बिस्मत में क्या होता है एग्जैक्टली आप बताएं. अब देखो बोगस ये एलन की नोट में क्या होता है.
Vomit हो जाता है, solids
सॉलिड्स आर रिटेन्ड. यहाँ पे क्या होता है.
relieved by cold drink इसमें भी है.
नहीं. इसमें क्या होता है. If they will take solids, they'll throw them up. Cold drinks are better. Bismuth का अब वो symptom opposite correlate है. It's an antithesis. Okay, the symptom wise. So what it does is in bismuth में they're able to retain the solids, but you give them liquids and they're thrown up immediately. Okay. In this, they will crave for cold drinks and they'll be able to retain it. But if you give them something to eat, what they'll do is they'll throw them up. Okay. So, so lots, all the symptoms of mind, disposition, like generally, Cuprum majorly has a craving for cold food and cold drinks generally. So that is a concomitant. Every symptom which is in addition related to the personality then becomes a concomitant. This is how you have to memorize and understand your convulsive remedies. You have to divide them symptom wise. Only then you will be able to prescribe them with accurate homeopathicity. Like for instance, if you'll see in Cuprum, you'll find one symptom. So the eyes are oscillating side to side under the eyes closed, it's a symptom of the ictal phase. Okay, eyes oscillating side to side in the ictal phase. Now, is that common or uncommon?
Uncommon.
It may happen in convulsive patients, it may not happen in convulsive patients. But that's also one of the symptoms of the ictal phase, that the eyes oscillate side to side and the eyes are shut. Okay. Now, if you find that in sleep, is that a common phenomena or uncommon? It's REM sleep. But if that happens during the convulsion, then it becomes a symptom which you may consider as a part of your framing of totality of symptoms. Eventually, whether you use that for prescribing or not, it depends on the total evaluation. Remember, in homeopathy, what's more important? One symptom does not govern your prescription. All the symptoms of the totality of symptoms have to fall in line. Are we together? Yes, no? Great. So you have to keep that in mind. Okay? So, this much for today. Next class, we continue studying Cuprum et more. It's one of the finest remedies. The sad part is it is restricted to as one of the remedies only for convulsive phenomena. And I'm sorry to say, most of the homeopaths prescribe it as one of the combination remedies for convulsive phenomena without understanding the homeopathicity. Okay, the idea is to understand the homeopathicity, and please, in the next class, just for yourself, create this kind of a description and bring to the class. Trust me, it'll help you understand the remedy better. Your prescription will become better. Okay, and please share it with me. Okay.
So, also mentioning is that easy relapsing and latency.
Latency.
Both are the same.
So latency is when the suppressions will happen. Okay, so the so for instance, if you are ever going to treat somebody with seizure phenomena, okay, when will your prescription be? In the acute phase or in the lucid interval? That's what he's talking about. And what will your symptom prescription be based on majorly? The symptoms in this phase or symptoms in this phase? Always in the symptoms of lucid interval. This is one of the intermittent diseases. Prescription will not be based on this. Prescription will be based on what are the triggering factors, pre-ictal, ictal, post-ictal, and especially the concomitants and the symptoms which arise during the lucid interval. That's where your prescription will be. Are we together? Great, guys. Take care.
Sir, where it talks about the positive triggering factors, it also says metastasis or nothing happens to the brain. That is also suppressed.
That's saying suppression.